Today, we're diving into a quiet but absolutely critical crisis that's unfolding in homes all across the country: the shortage of home care workers. It's a system that's under an incredible amount of strain. But as we're about to see, there are some amazing innovators working from the inside out to fix it.
Okay, so first things first, we really need to get our heads around the sheer scale of this issue, and, maybe more importantly, just how urgent it is. This isn't some problem we can kick down the road for a decade. It's happening right now, and families are feeling it today.
And Stephen Landers just nails it with this quote: "The crisis is immediate." I mean, think about it. If you were to search for home care aid jobs in your town right now, you would see a flood of listings. The demand isn't on its way, it's already here, and it is huge.
Now, what's really wild about this is just how fast this has all happened. We're talking about the workforce more than doubling in a single decade. It jumped from 1.4 million aides to 3.2 million. That is just an explosive rate of growth for any industry, period.
And believe me, it is not slowing down. Projections show that we're going to need to find another 740,000 aides over the next 10 years. That's a massive gap between the care people desperately need and the actual workers available to provide it. So, this all leads to a really fundamental question, right? If demand is through the roof, why on earth is there a shortage? Well, let's dig into the paradox that's really at the heart of this whole system. This crazy disconnect between what families are paying for care and what the workers themselves are actually earning.
In this slide, this really tells the story. Consumers, the families, are paying a median rate of $34 an hour for a home health aide. But the aide, the person providing that essential, incredibly personal care, is earning less than half of that, with a median wage under 17 bucks an hour. So where's the rest of that money going? Well, a huge chunk gets eaten up by agency overhead. Insurance, admin costs, profit, leaving the actual caregiver with scraps.
And you can imagine what this economic reality does to the workforce. The annual turnover rate is approaching an absolutely staggering 80%. Think about that. The workforce is mostly women, a third of whom are immigrants, and so many of them are living in low-income households themselves. When a job is this demanding and pays so little, it's just no surprise people can't afford to stay in it.
And that really is the central paradox we have to solve. How can one of the fastest-growing, most essential jobs in the entire country also be one of the most unstable and poorly paid? The answer, it seems, might mean we have to rethink the entire structure of the industry from the ground up.
And that is exactly what's starting to happen. Instead of just waiting around for some big top-down solution, innovators are building new models from the inside. And you know what? They all share one single core idea. To fix home care, you have to start by investing in the caregiver.
So we're going to explore 3 really promising approaches that are already showing some incredible results. We've got worker-owned cooperatives, digital registries that connect clients and aides directly, and specialized training programs that are giving workers powerful new skills. All right, let's start with these worker-owned co-ops. The concept here is actually pretty simple, but it is so powerful. The agency is literally owned and run by the caregivers themselves. This just flips the traditional model completely on its head. It gives workers a direct financial stake and a real say in how the business operates.
And wow, the impact is just undeniable. Look at these numbers. Worker turnover, it gets cut in half, dropping from that crazy 80% down to around 40%. Pay goes up by about $2 an hour. And maybe the most important thing of all, clients get to keep their caregivers for twice as long. That creates so much stability and continuity of care, which is just priceless.
But it's not just about the money. When a UCLA researcher, Jeffrey Gusoff, asked the co-op members what made the biggest difference for them, the overwhelming answer was about empowerment. It was, I have more say, feeling respected, that sense of ownership. That's what really changes the game. Okay, so let's move on to the second innovation. These digital registries. Platforms like Carina are basically online marketplaces that completely cut out the traditional agency middleman. And these aren't small-time operations either. We're talking about connecting tens of thousands of providers and clients directly. And the whole philosophy here, as Carina's CEO Nidhi Mirani explains, is all about finding the right fit. I mean, having someone provide care in your home is an incredibly personal relationship. So these platforms, they allow both the clients and the caregivers to actually choose each other, making it a two-way street that's built on a mutual connection, not just whoever an agency happens to send over. And the third big idea is all about upskilling the workforce. One team developed this simple 90-minute online training module just for aides, all about the early warning signs of heart failure. Things like leg swelling or shortness of breath.
This simple training equips them to be the first line of defense in managing a serious chronic condition.
And the results? They're profound. When aides are empowered with this kind of knowledge and a simple app to report symptoms, their patients end up with fewer ER visits and they make fewer 911 calls. It's just better for the patient, it's more empowering for the aide, and it saves the entire healthcare system a ton of money. It's a win-win-win.
So when you take a step back and look at all of these different solutions, the co-ops, the registries, the specialized training, you start to see a single powerful theme emerge. The path to better care for our loved ones, for our aging population, it runs directly through empowering the caregivers themselves. And that's really the bottom line of our explainer today. If we want to fix this crisis for the people who need the care, we absolutely have to start by fixing it for the people who give the care. Investing in them, with better pay, a sense of ownership, and real skills, isn't just a nice perk for the worker, it is the single most effective way to improve the quality of care for everybody.
And that leaves us with one last crucial question. We know that the vast majority of people want to grow old in their own homes, and we've just seen that these worker-focused models can really truly work. The challenge now is a big one. Can these innovations be scaled up to meet the enormous wave of demand that's coming, and in the process, redefine our entire approach to care? Thanks for joining us.